I will discuss about the pure tone audiometry. In pure tone audiometry, we test the hearing sensitivity of a subject only for pure tone sounds. The sounds that we hear in nature are complex sounds. The complex sounds are that sounds of various frequency and intensities. The pure tone audiometry provides a quantitative measurement of a subject's hearing. The aim of the pure tone audiometry is whether the subject has a definitive hearing loss or not. If the patient have a hearing loss, whether it is conductive, sensorineural or mixed. If the patient have a sensorineural hearing loss, whether it is cochlear or retrocochlear, and the degree of hearing dysfunction. The PTA, pure tone audiometry, doesn't determine the exact pathology of the disorder. Now comes the audiometer is an electronic device which produces pure tones, and the intensity of which can be increased or decreased in a 5 decibel step. This is the instrument audiometer used for the pure tone audiometry. We look for the air conduction and the bone conduction. Usually the air conduction results are measured for the tones of 125 Hz to 8000 Hz, and for the bone conduction 250 Hz to 4000 Hz. The amount of intensity that has to be raised above the normal level is a measure of the degree of hearing impairment at that frequency. When the results are plotted graphically or charted in the form of graph is called as a audiogram. The threshold of a bone conduction is a measure of cochlear function, and the difference of the thresholds of air and bone conduction is a measure of degree of conductive deafness. It may be noted that the audiometer is so calibrated that the hearing of a normal person, both for the air conduction and the bone conduction, is at 0 decibel, and there is a no air-bone gap, while the tuning fork test normally shows air conduction is more than bone conduction. For pure tone audiometry, a term is used masking, means presenting a noise into a non-test ear so that the non-test ear is acoustically blocked and doesn't participate in the hearing test. The masking is done in the all cases of bone conduction, and when the difference between the two ear of 40 decibel or more for above for the air conduction threshold, the better ear is masked to avoid getting the shadow curve from the non-test ear. Now comes the uses of pure tone audiogram. It is a measure of threshold of hearing by ear and bone conduction, and thus the degree of and type of hearing loss. A record can be kept for the future reference. The audiogram is essential for precision of the hearing aid. It helps to find the degree of handicap for the medico-legal purpose and help to predict the speech reception threshold. Now comes on the various symbols used for the in audiogram, and for the air conduction and bone conduction when the ear is masked or unmasked, these are different symbols. The color for the right ear is red and for the left ear is blue. These are the different symbols used. Now how to solve the queries or MCQs or questions related to the pure tone audiogram. When you get an audiogram, first you look at the audiogram is given of which ear, right or left. It can be identify the color of the audiogram. When the color is red, it's of right side, R, red, right, and for the left ear the color is blue. Now calculate the air conduction and calculate the air conduction by adding hearing in decibel at three frequencies 500, 1K and 2K and divided by 3. Get the average. Calculate the bone conduction similar to the air conduction, and last step is calculate the air-bone gap, the gap between the air conduction and the bone conduction. For the normal audiogram, the air conduction should be less than 25 decibel, the bone conduction is also less than 20 decibel, and the air-bone gap is also less than 20 decibel. Now looks in the given audiogram. First look at the color. The color is blue, means it is of the left side, and for the air conduction for the left ear, the cross is used for the air conduction and symbol of more than used for the bone conduction. If we look at the three frequency 500, 1K and 2K, 500 the air conduction is approximately 10 decibel, at 1000 it is 5 decibel, at 2000 it is 0 decibel. It is average is 15 divided by 3 is 5 decibel, means less than 20 decibel, less than 25 decibel means normal. The bone conduction is also normal, and there is a no the air bone gap, means this is of the given audiogram is normal. Now comes on the whether the given audiogram of conductive hearing loss or sensory hearing loss. When the given audiogram have a conductive hearing loss, the air conduction is more than 25 decibel, the bone conduction is less than 20 decibel, and the air bone gap is more than 25 decibel. Now look in the given audiogram. The color is blue, means it's of the left ear. Look at the air conduction. At 500 it's approximately 45 decibel, at 1k also 45 decibel, and at 2k is sustainable. It is more than 25 decibel, means the patient have a hearing loss. Bone conduction 0.5 approximately normal, less than 20 decibel, and the airborne gap, look at the 500 it's approximately 45 decibel, at 1k is also it's approximately 45 decibel, and at 2k it approximately 60 decibel, means the airborne gap is more than 20 decibel. So the given audiogram of a patient having a conductive hearing loss, means the airborne gap is more than 25 decibel, or air conduction is also more than 25 decibel, and the bone conduction is normal. When the given patient have a sensory neural hearing loss, the sensory neural hearing loss patient have a air conduction more than 25 decibel, bone conduction is more than 25 decibel, and the air bone gap is less than 20 decibel, means normal. Look at the given audiogram. First we look for the right ear. The color is red. The symbol for the air conduction is circle for the right ear. At 500 it approximately 25 decibel, at 1k 35 decibel, or at 2k it's approximately 55 decibel. Means the air conduction is more than 25 decibel, means patient have a definitive hearing loss, and the bone conduction is also similar to the air conduction, and there is a no air bone gap, means air conduction is more than 25 decibel, bone conduction is more than 20 decibel, and there is a no air bone gap, means the patient have a sensory neural hearing loss. Similarly, look for the left ear. The patient left ear, the color is used is the blue, the cross for the air conduction, and symbol more than for the bone conduction. It's also similar to the right ear. So the patient given audiogram patient have a bilateral sensory hearing loss. If the patient have a mixed hearing loss, the air conduction is more than 45 decibel, the bone conduction is more than 20 decibel, and the air bone gap is also more than 20 decibel. Now look at the given. There is some special conditions for the ear and bone conduction. Look at this audiogram. The ear this is given for the given audiogram of the left ear because the color is blue. Look at the air conduction. At the 500 it's approximately 50 decibel, 1k 60 decibel, or at 2k is approximately 65 decibel, means more than average is calculated more than 45 decibel. The bone conduction is also more than 20 decibel, and there is a definitive airborne gap, means the given audiogram of the patient have a both sensory neural and conductive hearing loss, means mixed hearing loss. There are some special conditions of the there in Meniere's disease. The hallmark feature of the is a low frequency sensory neural hearing loss. In the early stages there is a low frequency affected, so the graph is of the rising type. Later, when the higher frequencies are involved, the first curve becomes flat, then falling type. Later on, the another condition is a dip at 2000 hertz seen in the otosclerosis known as a Hertz notch. Look at the bone conduction of the left ear, and there is a sudden dip at 2000 hertz, means this is known as a Hertz notch, and it is successfully disappear after the successful stapedectomy or stepodotomy. And the last image of the given here, see the both on the air conduction and bone conduction sudden dip at the 4000 hertz. It's known as a Boiler's notch seen in the noise induced hearing loss. This is all about pure tone audiometer and the related queries to that, and how to solve the questions related to the pure tone audiogram. If you have any query, or related to that, you can directly message me or mail me or leave a message. This is thank you.